Hi everybody, welcome back to the YouTube channel Mental Matters More. I am Amanda G. Psych NP, and this is the channel where we talk about all things related to mental health. So today I wanted to talk about a diagnostic tool or measure that we have in mental health that helps us when we are trying to prescribe medications and figure out what's going to work best for an individual, and it's called genetic testing. You probably have heard your parents or somebody say, I don't do that medication well, or I can't take this kind of medication, or I need more of certain types of medication for it to work for me. And so that's because of their genetic makeup. Well, we're probably all familiar with the dosing that comes on the back of medication bottles or prescription medication. There's a certain way that we're supposed to take it, maybe one pill every 4 to 6 hours. So that has come about as a standard for the normal individual. Fortunately or unfortunately, some of us don't fall into that category, and this is where genetic testing could really help us do a customized, individualized treatment plan that includes medications that are going to be appropriate for your specific genetic makeup. Now, there are many different companies out there that do the testing. A lot of us are familiar with DNA testing or Ancestry DNA. That is one that does so you can kind of see your roots or your background. But same idea in healthcare, where we have a test. I use a company called GeneSight, and they will give us a report back based on your genetic makeup that's going to tell us medications that are going to best work for you, maybe medications that won't work the greatest for you, and then medications that may have a significant interaction with. So I have my GeneSight kit right here, and I wanted to kind of show you how simple it is to do genetic testing. So usually I have this kit to go to somebody's house, and they'll get it like this in the mail. Inside you will see an envelope, and it's got your information. You fill out there. And then here is going to have a disclaimer about some information that they're going to send to the insurance company. The thing about genetic testing is some insurances do not cover it. Other insurances don't cover it completely. So it's always best to check with your insurance company to know so you don't get a surprise bill. Nobody wants that surprise bill. But they will tell you on here that if it's going to be more than $300, they will actually contact you to see if you want to continue with the process. So they will let you know if it's going to be a large out of pocket. I will tell you, I did this for a family member and I didn't get a call and I did get a bill for $300. So it might be right on the dot. So you take your envelope, fill it out, and then they give you a little swab, a little cheek swab that everybody has probably familiar with these. And you just pop it open, follow the directions, swab the side of your cheek like that. And then literally just open this, slide it in there, seal it. And then there's a phone number on here that you call and FedEx will come and pick it up from your house. And then in about 3 to 5 days, we get a report back with your genetic testing results. So for my specific practice, psychiatric, I want to find out about psychotropic medications. And that's what they give us the report back. It will show antidepressants, antipsychotics, anti-anxiety medication, mood stabilizers, and stimulants. What's going to work best for your genetic makeup? While some people believe that genetic testing is going to be the future of medicine, really, others are a little bit more leery. So there is some controversy around genetic testing. And that's because some evidence has shown that there's not much difference in the way our prescribing would be when we get the genetic testing. We're still going to do our evidence-based treatment, and we're going to use certain classes of medication and then on to the next. Some providers may not believe in genetic testing, and certainly that's their right. I do believe in genetic testing. I think that it's beneficial. I think that even if it would give us the same results in terms of medication, it's going to help overall to know that we're on the right track. It's going to give peace of mind, which to me is priceless. And it's also a report that you have for the rest of your life going forward. If maybe you have another issue with medication and you can show your provider, this is my genetic testing I had done, and it could help prescribe the best medication faster. There's also another marker that we can test for with the genetic testing, which is called the MTHFR gene mutation. And essentially that's the way our body processes or doesn't process folate. So that's important to know. There's a big tie between mental health, anxiety, depression, and individuals who do not process folate correctly. So once we have that information and we know if we're processing it or not, or partially, we can add a supplement that's going to allow our body to process as we need it to be. As I've talked about in my other videos, it's really a comprehensive, holistic approach that I think is best for individuals. So finding out their genetic makeup, finding out if they need a supplement, all of these are important parts and factors and parts of the puzzle for mental health. If you have a provider, I would ask them about genetic testing, see if it's an option. And if they don't provide it, possibly find somebody that will. Once again, this is the YouTube channel Mental Matters More, and I am Amanda G, Psych NP. Today we were talking about genetic testing. I will put a link in the description below for some more information on genetic testing, including the company that I use if you want to check it out. And again, this is the channel where we talk about all matters related to mental health. So let me know if there's something that you'd like me to talk about for you. Go ahead and put it in the comment below, subscribe, and I look forward to seeing you soon.